Every dog owner knows that sinking feeling in their stomach. One day, your best friend is bouncing off the walls, and the next, they're just not. They're quiet, they won't eat, and you just know something is wrong. So, what really happens when you walk into that vet clinic? Let's follow the journey.
It's a scenario that just sends a chill down your spine, right? The thing is, these symptoms are so vague, they could mean anything from a simple tummy ache to something way more serious. So, how in the world does a veterinarian even begin to solve that puzzle?
To figure that out, we're going to dive into a real case study from the vet school at the University of Edinburgh. And our story starts with this 6-year-old boxer. She'd been lethargic and had lost her appetite not just for a day or two, but for weeks. You can imagine how worried her owners were.
All right, Section 1. This is where our diagnostic journey really kicks off, with a mysterious illness and a family that's just desperate for some answers.
So the vet does a complete physical exam, and sure enough, the dog was quiet, really subdued. But her heart sounded good, her lungs were clear, there were no obvious signs of pain anywhere. And for the owners, this is both a relief and just so frustrating. If nothing's obviously wrong, then why isn't she acting like herself?
And that's the million-dollar question, isn't it? When the outward signs are so nonspecific, the investigation has to cast this huge wide net to try and figure out what's really happening on the inside.
So, to solve the mystery, vets start by creating something called a list of differential diagnoses, which is basically a fancy way of saying a checklist of all the usual suspects they have to rule out one by one.
I mean, just look at how broad this initial list is. A vet's brain has to immediately jump from potential metabolic problems like low blood sugar to endocrine disorders, heart problems, hidden infections, or even the possibility of cancer. It's an incredibly complex mental flowchart for a symptom as simple as "my dog seems tired."
With a list that long and a little intimidating, the first step is always to rule out the simplest, most common causes. And for a lot of us, one of the first questions that pops into our heads is, hey, could this have something to do with a recent vaccine?
And yeah, according to Dial a Vet, feeling a little bit sluggish after a shot is generally a totally normal reaction. It's really just a sign that your dog's immune system is kicking into gear and doing exactly what we want it to do, building up protection.
But here's the key, the timeline. That post-vaccine sluggishness is mild, and it should be gone within 48 hours tops. Since our boxer has been sick for weeks, we can confidently cross this one right off the list and dig a little deeper.
All right, next on our list of suspects is a massive category of concern, especially here in North America. We're talking about infectious diseases, and more specifically, the threat that comes from ticks. Now, this is a critical piece of the puzzle. As Main Street Veterinary Services points out, the initial symptoms of pretty much all tick-borne diseases look almost identical. It's like a flu. You get a fever, lethargy, and loss of appetite. Sound familiar? These are the exact signs our boxer is showing. And the threat really depends on where you live. This slide gives a fantastic overview of which ticks are common in different parts of North America. You've got the deer tick, the famous carrier of Lyme's disease, mostly up in the Northeast and upper Midwest. Then there's the American dog tick, which can carry Rocky Mountain spotted fever, and it's found pretty much everywhere east of the Rockies. Knowing what's in your own backyard is half the battle.
So, this naturally leads to a really common debate among dog owners, especially if you live in a high-risk area. If Lyme is such a big deal, shouldn't we just vaccinate every single dog against it? Well, the experts say it's actually not that simple. Take UC Davis Veterinary School, for example. They point out that in places like Northern California, where Lyme disease is extremely rare, the vaccine isn't generally recommended because the risk of a dog even being exposed is just so low. And this right here really gets to the heart of it. The University of Wisconsin explains that this whole decision is about risk versus benefit. In areas with low infection rates, the vaccine might not offer any value, but in hotspots, where more than half the ticks might be carrying the disease, it can be a lifesaver. The bottom line, it's a critical conversation to have with your local vet who knows the risks in your specific area.
Okay, so we've ruled out vaccines and we've considered ticks for our adult boxer. But it's really worth taking a quick detour here, because when you're talking about these same vague symptoms, the whole situation changes when the patient is a puppy. For them, lethargy isn't just a symptom, it can be a 5-alarm fire.
This comparison from the Palm Valley Animal Society is so important for anyone with a young dog. A normal puppy, they have these insane bursts of energy and then they crash for a nap. But a puppy with fading puppy syndrome isn't just tired. They are extremely lethargic, maybe they can't even stand up, they feel cold, they're crying. This isn't just a sick puppy. This is a puppy in a life-threatening crisis.
Okay, let's get back to our boxer's case. The vets have worked through dozens of possibilities. They've run the initial screens. So, after all that investigation, what did they finally find?
The answer was nothing. Absolutely nothing. The blood work was normal, the chest x-rays and the abdominal ultrasound all clear. All the standard tests that should have caught most of the diseases on that big list came back clean. The mystery was only getting deeper.
So, with all the other roads leading to a dead end, the vets started thinking, maybe this is neurological. They performed an MRI, and finally, they had their answer, visible right here, a big mass growing on the pituitary gland, right at the base of the brain.
Okay, that's a mouthful. The official diagnosis was a pituitary macroadenoma. Now, the good news is that it's a non-cancerous tumor. But the bad news is that because of where it was and how big it was literally putting pressure on the brain. The vets call this a space-occupying effect, and that was the hidden source of all her vague signs like lethargy and depression.
So what do? The treatment in this case was highly focused radiotherapy, and the result was pretty remarkable. By the end of the treatment, the dog's symptoms had vastly improved. The mystery was solved, and our boxer was finally on the road to getting back to her old self. So after that incredible diagnostic journey, what can we as owners take away from all this? It really all comes down to being an active partner in your pet's health.
First, and most importantly, know your pet's baseline. You are the world's leading expert on what's normal for them. Second, practice prevention. That means good tick control and having that real, risk-based vaccine talk with your vet. Third, be a good observer. Knowing that the boxer's lethargy had lasted for weeks was a massive clue. And finally, remember you are a partner to your vet. Giving them a clear, detailed history is one of the most powerful tools they have.
This case just proves that even the vaguest signs are worth taking seriously. So I'll leave you with this question. What's one thing you can do this week to really pay attention and better understand your dog's normal energy levels, their appetite, their behavior? Because that knowledge, that's the first and most important step in any diagnostic journey. Thanks for watching.